Hi, my name is Dr. Terry Zachary and I'm the developer of the Grip Saver Plus by Metolius. I want to talk to you about some of the mechanics of climbing. And the climbing athlete are amongst the, of course, most challenged as far as grip mechanics go in their sport, and they're also the most educated as far as the grip and the grip mechanics are concerned. I want to show you a few things that will bring the climber up to date on how we develop the Grip Saver Plus. In practice, I saw a lot of extensor tendonitis, a lot of tennis elbow, and a lot of hand, wrist, and elbow problems in general. And climbers inevitably, depending on how they trained, or if they didn't train at all, would come with very, very shortened flexor muscles and then very weak to average finger extensor muscles. And this is the imbalance that comes from all repetitive grip activities. Climbing being really one of the highlighted sports in repetitive gripping. So we did EMG studies to show the finger muscle pattern between the finger extensor muscles and the finger flexor muscles. And we can show you why it is so important to strengthen and balance both of these muscle groups if we're going to have the most stability, strength, and injury prevention possible. You can see on our raw EMG study of the climber just how active the finger extensor muscles are throughout the climb, which surprises some climbers. The finger extensor muscle pattern is in green on these EMG patterns, and the finger flexor muscle group is in red. So just observe how much that, yes, the finger flexor muscles are extremely active, but the finger flexor muscle, extensor muscles are also very active, because the finger extensor muscles that come on the whole back of the finger, wrist, forearm, all the way to the elbow, those finger muscles contract in support of anything we do for flexion. So whenever the flexor muscles grip, these finger muscles are contracting to stabilize that grip. And then obviously, as we'll show you in a second, anytime the finger muscles open to go to a new hold, then they're going to be active as well. So now we're going to go a little more up close with the climber to a little segment of the raw EMG and show you just how active those finger extensor muscles are. When the climber goes into a new hold, meaning they go to grab onto a new hold, you can see how the finger flexor muscle pattern fires, as well as the finger extensor muscle pattern firing in support of the finger flexion. Okay? And then we'll also see when the climber goes to opens to grasp, that the finger extensor muscles now become more dominant in comparative to the finger flexor muscles. So just really interesting pattern. And now that we can see EMG patterns for the climber, it becomes very obvious why the climber has to strengthen both the flexor muscles that close the hand and the extensor muscles that open and spread the fingers. These are the stabilizer muscles. They're very important. If these are not trained, the tendency is for the climber to get very shortened in the flexor muscles as opposed to the extensor muscles. So climbers, you have to keep those finger flexor and finger extensor muscles in balance for the maximum strength, stability, stamina, and of course injury prevention. If you'd like more information on the Grip Saver Plus, please visit metoliusclimbing.com and you can see a lot more information as far as grip and grip muscle balance is concerned.